This is the first of 3 short videos about pediatric metabolic disorder. What is a metabolic problem? It's the inability for someone to break down food sources into energy. So we have diseases that are caused by defects that are specific to proteins, in that they lack the enzymes to convert one to the other, and we need those in order to metabolize parts of the food products. When food products are not metabolized properly, it results in a buildup of toxic chemicals within the body. And these toxic chemicals can cause permanent, non-reversible neurologic problems. There are endocrine disorders such as congenital hypothyroidism and growth hormone deficiency that also contribute to metabolic problems. We need growth hormone to be able to grow, and children who have this deficiency have an issue with hypoglycemia because of the sensitivity to insulin. Hypothyroid, as you know, the thyroid controls our metabolism. So when the thyroid is not functioning properly, either too little or too much, it alters our metabolic rate. Signs and symptoms of metabolic disorder related to toxins include fatigue, hypoglycemia, altered level of consciousness, irritability, and eventually we're going to see regression of developmental milestones. Some of the disorders can lead to seizure disorders, and then many of them result in failure to thrive. How do infants present with these type of problems? They don't feel good, but how do they let their parents know that they're sick? Infants have poor ability to communicate with us when something is going wrong. Do they have an energy deficit, or do they have behavior that's a result of toxin buildup? They can develop acidosis, elevated ammonia levels, as well as the hypoglycemia. They have agitation and are not comforted by usual methods, and poor feeding. And as stated earlier, vomiting and seizures can develop. When any of these metabolic issues affect the neurosystem, it can lead to altered mental status and eventually into a coma. The disorders we're going to talk about are the most common ones. The students that are going to chalk will most likely run into some very unusual and rare metabolic disorders. There are hundreds of them, and some of them only occur 1 in 3 million kids, but they happen to be at chalk. So know that a lot of these issues, although rare, they have a similar clinical profile, and they all need to be evaluated. In addition to all of the symptoms discussed on the previous slide, these children may succumb and end up dying. What do we do about these? We have the California Newborn Screening Test. It began in 1966 and only looked for a PKU disorder. It wasn't until 1980 that we started adding additional tests, and we had galactosemia disorder added. 10 years later, we started screening for hypothyroidism, that would be congenital, sickle cell disease, and other non-sickling hemoglobin problems, as in thalassemias. It took another 15 years until we started looking for congenital adrenal hyperplasia. A couple of years later, we added cystic fibrosis. But cystic fibrosis, as you heard in the respiratory lecture, it's fairly common. And if we can intervene early, it makes a huge difference on the child's development and quality of life. In 2010, an additional immunodeficiency panel was added. So in some states, there are 5 tests that they're doing, while in other states there are up to 35, and they're looking for a lot of the enzyme deficiencies. The test costs a little more than $100. It's covered by covered California, and all of the insurance plans. The test is performed prior to discharge from the mother-baby unit. So the baby has to at least have had a feeding, and within 12 to 24 hours, we will do the test. Any positive test result requires contacting the parents. So part of your job, in addition to getting the test on the blotter of the paper, is making sure that we have the correct contact information, address, telephone numbers, and names. When we contact the parents, we let them know that their screen came out positive for a specific disorder, and we need to repeat the test to make sure that it is accurate. We don't base the diagnosis on one test. The California screening and actually the newborn screening, which is done across the nation, diagnoses close to 7,000 disorders per year, and that's 7,000 kids that we're actually improving their quality of life. So this ends part one.